A proposed bill in Tennessee could repeal laws that some say are limiting access to critical health care services. Good evening, I'm Sarah Diamond.
I'm Josh Smith. Certificate of Need laws. They require providers to seek state permission before expanding their practice or purchasing new equipment. Acute hospital beds, MRI scans, substance abuse treatment, and hospital care. Just 4 of the more than 20 services regulated this way in Tennessee. Jackie DeFusco found out why one lawmaker thinks a total repeal would go too far.
Josh, Sarah, Senator CROWE says certificate of need laws were initially passed across the country to expand access, improve quality, and lower the cost of care. Now, critics say the opposite is happening. Greenville doctor Robert Berry says CON laws in Tennessee are limiting patient choice.
I'm having a lot of patients who are going outside of the area because they've lost confidence in local health care.
15 states have already repealed their CON laws. Tennessee could be next if a bill by Representative Martin Daniel passes.
The economic market should determine supply and demand, not the government.
Critics say state approval can be cumbersome for providers, taking years and potentially costing hundreds of thousands of dollars.
Those who are already in the market can come before the con regulator and make the case as to why they would prefer not to have any competition. It's essentially designed to protect the incumbent providers.
Daniel says Tennessee has some of the most burdensome regulations in the country. Senator CROWE says otherwise.
Our process is pretty darn good. I think it needs to be modified, and we're going to modify it. That's why we're studying it this summer.
CROWE says repealing CON laws entirely could oversaturate the market with services and put hospitals at a disadvantage.
Obviously, if we didn't have a CON process, those rural hospitals that don't have enough volume would be in deep trouble because there wouldn't be enough paying patients and patients with insurance to make up for all those they have to do for nothing.
Yet some research shows states that have repealed their CON laws have better health care access.
In states that have certificate of need laws, not only are there 30% fewer hospitals overall, there are 30% fewer rural hospitals as well. And there are also fewer ambulatory surgery centers in both urban and rural settings.
The senior research fellow I spoke to says there's no evidence that shows that CON laws lower the cost of care. Plus, he says a recent study showed that states that have repealed their laws actually perform better on a number of quality metrics. Josh, Sarah.
Jackie, thanks. In a statement, Ballad Health said they haven't challenged any certificate of need application since the hospital system was created in 2018.
Ballad's statement also said CON laws prevent unnecessary duplication of services that can result in financial jeopardy for community hospitals, particularly in rural areas. You can read their full statement right now on WJHL.com.